or false beliefs about hypnosis. These ideas are usually originated or influenced by movies, shows, or stage magicians who use hypnosis as an entertainment feature or to demonstrate their power to control another person's mind. While in reality, hypnosis is a very precious modality in pain management, treatment of psychosomatic disorders, management of stress and anxiety, and changing unwanted habits. Let's start with the definition of hypnosis. The term hypnosis refers to hypnos, the Greek god of sleep. During its history, hypnosis has been defined in many different and often controversial ways, but a simple definition of hypnosis is a special state of consciousness in which certain mental capabilities are heightened while others fade into a subconscious background. And that's why hypnosis is referred to as empowering the mind. Not that hypnosis can infuse more power into your mind, but it can actually let you get the most out of your own mental power. It's generally accepted that all hypnosis is self-hypnosis, and the hypnotist is simply a guide who leads you through or shows you the ropes, how to enhance your mental power and how to gain control over your desires, your feelings, your emotions, and your habits. History of hypnosis goes back to ancient Greece. Let me get back to screen. When priests or so-called demigods used to create a trance-like sleep to cure certain illnesses. But a distinct concept of hypnosis owes its existence to an 18th century physician by the name of Frank Mesmer. Mesmer had a deep interest in astrology, also a strong belief in influence of supernaturals or so-called heavenly bodies on human life. He initially used gravitation and magnetism to describe his healing work, but later he became to believe that it was not the physical forces of the magnet, but it was he himself producing the cure. Subsequently, he modified his initial theory. His followers created three different variations of his hypothesis: the spiritual, the religious, and the scientific versions of magnetism. After Mesmer, it was Dr. James Braid who first coined the term hypnosis back in 1843. Dr. Braid and then Dr. Esdale, who were both surgeons, reported successful use of hypnotic sleep with hundreds of surgeries. In explanation, they suggested a neural inhibition induced by hypnosis. This theory was not scientifically accepted until several years later when Ivan Pavlov introduced his neural inhibition theory in his concept of physiology of sleep. With the advent of chloroform, hypnotic anesthesia lost its attraction until the late 19th century when psychiatry became interested in hypnosis. Sigmund Freud and Morton Prince were two psychiatrists who started treating patients with anxiety and personality disorders with hypnosis. As I mentioned earlier, Hypnosis can be used in a variety of mental and behavioral disorders. But the focus of this talk will be role of hypnosis in management of stress and anxiety. But what is stress and how to define it? There are different definitions of stress, whether it's defined by a psychiatrist, by a behavioral therapist, by a management consultant, or by a clinician. But the most commonly accepted definition of stress is a condition or feeling experienced when an individual perceives that demands exceed the accessible or available personal and social resources. And a practical definition of stress is an uncomfortable gap between how we would like the situation to be and how it actually is. Stress can release powerful neurochemical and hormones that prepare our body for action. If we do not take action, stress response can lead to health problems. Many of the usual or common ways of dealing with stress, including medications, alcohol, smoking, shopping, and eating, can actually be counterproductive and make us more reactive to further stress. But stress is not always associated with a negative outcome. Some degree of stress and anxiety can be helpful. It can create a reaction we call positive adaptive behavior. Many of us have experienced a better performance under pressure of deadline because the resulting anxiety motivates us. But if the stressor is beyond our tolerance, it can result in serious problems. According to American Academy of Family Physicians, 85% of all physical illnesses are stress-related, either caused by or aggravated by stress. And another study conducted by Metropolitan Life Insurance Company showed that an average of 1 million workers are absent on any given day due to stress. I have to mention all these studies were done prior to COVID crisis. And of course, during crisis, all these stats are significantly higher. Another study showed that job-related stress, or so-called occupational stress, estimated to cost businesses over $150 billion per year. Noteworthy that declined performance due to stress is not even considered in this study, only absence from work. And stress-related disability cases have doubled in the past 10 years. The conclusion is, aside from being a health threat, stress can have major socioeconomic impact as well. But how does it manifest? And how does our body react to stress? Common manifestations of stress are, but not limited to, recurrent headaches, more commonly in form of tension headache, and quite often resistant to regular analgesics. Chest pain, or more commonly chest tightness, restlessness and irritability, dizziness, lightheadedness, and even syncope or fainting episodes, fatigue, weakness, and feeling lack of energy, shortness of breath, abdominal pain and cramps, which is usually in form of indigestion, diarrhea, and quite often alternating diarrhea and constipation, eating disorders, which is usually in form of overeating, insomnia and sleep disturbances, including nightmares, and sexual dysfunction. Of course, possibility of organic disorders, substance abuse, and medication side effects has to be ruled out prior to attributing any of these symptoms to stress. Therefore, a comprehensive workup and assessment of the patient is always necessary. In terms of management, different modalities can be used in management of stress and anxiety, including Progressive muscular relaxation, biofeedback, cognitive therapy and reconstructing techniques, hypnosis, that we'll talk a little more about it, flotation or REST, R-E-S-T, restricted environmental stimulation technique, and more recently, virtual reality therapy. Multiple research studies have proven that hypnosis not only relaxes the mind, but also can either completely prevent or at least alleviate systemic response and manifestations of stress. Combinations of two techniques can be used in stress management as well. For example, combination of cognitive therapy and hypnosis. Combining the two creates a very powerful tool in stress management, as cognitive therapy targets conscious mind while hypnosis works at a subconscious level. During a session of hypnosis, the subject goes through a sequence of stages. These stages could be slightly different based on the technique we use for hypnosis, but they generally start with mental reception. It's very crucial in a session of hypnosis for the mind to be prepared and receptive. If you intentionally resist, you cannot be hypnotized. Someone with severe mental retardation, as well as someone with advanced dementia, cannot be hypnotized as well, simply because their mind is not receptive. Given the mental preparedness and reception, it starts with progressive relaxation, which usually starts with a muscular or physical relaxation and then progresses to a mental relaxation. Then deepening of relaxation, induction of trance, testing, and then stage of trance. During the trance, the mind is open and very receptive to suggestions. And this is the time that hypnotists can use positive suggestions to make the desired changes in the mind. For a session of hypnosis, you don't necessarily need a hypnotist. Instead, you can use a technique known as self-hypnosis. For a session of self-hypnosis, first you need to sit or lie down in a quiet and comfortable place. Your neck and your arms should be fully supported to the point that if you fall asleep, your neck and arms should not fall off the chair. So lying on a bed or a recliner chair would be the best. Close your eyes and deeply relax your muscles. For a muscle relaxation, there are two different techniques that you can use. One, you work on the entire body all at once. You start loosening your muscles, and then with each breath, you feel the tension is going away from your body. Tension is leaving your body. So your muscles are gradually getting more and more relaxed to the point that you get the feeling that your muscles are pretty much paralyzed, or you cannot even move them unless you work really, really hard. The other technique which I recommend for beginners, if you want to experience self-hypnosis first, the best is to start with the sequential muscle relaxation, in which case, instead of working on the entire body all at once, you start with one group of muscles. And the best is to start with your toes. Imagine relaxation like a wave, a relaxation wave entering your body through your toes. They start relaxing all your toes. Then gradually these waves move upward. They go to your calcaneum, to your ankle, move upward to your knees, and gradually, step by step, you feel more muscles are getting completely relaxed. Become aware of your breathing. Keep your mind focused on your breath, and each time you exhale, repeat the word relax silently. If distracting thoughts enter your mind, don't worry, it's totally normal. You have not lost the session. Simply ignore and brush them aside and continue with your session. Do not evaluate your performance during self-hypnosis. This is a common mistake that many people make, particularly when they experience it first few times. You don't need to evaluate yourself. Just go with the flow. You can be sure that you're doing good and you can do even better. But self-evaluation will cause a distraction. So avoid that and avoid any temptation to do it. You can continue that for about 15 to 20 minutes. And after that, open your eyes, gently move your arms, your legs, and then the entire body. And focus on your mind and think how free and how powerful your mind is after a deep mental relaxation. It's commonly asked if there is any possibility of adverse outcome with hypnosis. Either way, if it's guided by a hypnotist or done as a session of self-hypnosis. If the question is whether hypnosis can be dangerous, the answer is no. Hypnosis by itself cannot be dangerous. However, unwise use of suggestions can possibly create the opposite of the desired result. This brings us to some areas of concern in hypnosis. First one, aversion suggestion. Generally speaking, aversion suggestion and any kind of negative suggestion should be avoided during a hypnotic session. Although negative suggestion has its own specific indication, it's generally accepted that suggestions should be kept positive in hypnosis. Let me give you a couple examples. I hypnotize someone for the purpose of weight management. Under hypnosis, I create a mental image of this person who has become extremely obese, unable to function, barely able to move. This mental image has such a strong impact on the mind that the person can develop a pathological fear of food and refuse to eat even the required meals. Another example is I hypnotize someone for smoking cessation. Under hypnosis, I create a mental image of this person with lung cancer caused by smoking. The cancer is at terminal stage and no chance of recovery. After hypnosis, this person may become to believe that he already has lung cancer. Goes through extensive testing and evaluation, but all the negative workup and reassurance doesn't help. He still believes that he has lung cancer, but the tumor is still too small to be detectable. If any of these clinical scenarios happen, they can be very disturbing. However, it's not a disaster. In most cases, 1 or 2 more sessions of hypnosis can easily reverse the suggestions. Regression and false memories is another area of concern. Aside from the limited indication of regression therapy, this is another area to be avoided during hypnosis. A competent hypnotherapist should know the difference between leading and guiding questions and avoid creating any false image or false memory that can affect a person's subconscious or self-image. Then comes pain management, which is another major area of concern with hypnosis. Generally, like any other pain management modality, we do not want to suppress or kill a constant or recurrent pain without discovering the cause. Why? Pain is a warning symptom, like an alarm. It tells you there is something wrong. You need to figure out the cause, and then you can try either hypnosis, painkiller, or anything else to relieve the pain. So it's very unwise just to suppress or kill the pain without discovering the cause, particularly if it's a constant or recurrent pain. Antisocial behavior. Of course, no legitimate hypnotherapist would even consider using hypnosis to deceive someone or to induce inappropriate, immoral, or illegal behavior. However, in wrong hands or hands of an unethical person, there could be a potential for abuse. And then forensic hypnosis. This is a very interesting subject, particularly for people with background in law enforcement. Can we hypnotize criminal suspects and have them confess under hypnosis? And if so, is that confession a solid document in legal proceedings? Well, it depends where you are. Russia is the first country to officially and routinely use hypnosis in criminal investigation. In the US, state of Nevada is the first state to accept hypnotically obtained statement as evidence for judgment. Let me repeat, it's evidence, not document. And states of Oregon, Texas, Indiana, and California have Hypnotic Investigation Act. And finally, dependence. This is a concern that we frequently encounter while using hypnosis for stress management. After a session of hypnosis, the person feels relaxed and relieved from all the stress and tension. But unfortunately, the result does not last forever. After a few days to a couple of weeks, they feel a rebound. I'll come back for another session. This can happen again and again until the person feels totally dependent to hypnosis. Sometimes they feel they will be devastated in a nervous breakdown without it. And that's when self-hypnosis comes to the rescue, explaining to them that hypnotist is simply a guide who facilitates mental relaxation, and teaching them techniques for self-relaxation and self-hypnosis is usually successful in more than 95% of cases. Ladies and gentlemen, thank you very much for your attention. I'm here to answer any questions you might have.
Interesting. I'm sorry, I was on mute. Thank you, Dr. Mortazavi. That was very interesting. I've had some personal experience in residency with our psychiatrist treating some of our neurology patients with hypnosis, and I think that's been very helpful. For the Q&A, I think what might be best, since we do have a great turnout, if you do have a question, if you look on the toolbar at the bottom, you'll see a chat button. If you have a question, just press that button and just state your name, and I'll call upon you so you can ask for a question to Dr. Mortazavi. And while we do that, I actually have a question myself. As a neurologist, we see a lot of patients with a lot of psychological issues. How would I find someone who might be able to provide that kind of treatment, for my patients, and who would be the type of patient that might be good for hypnosis?
Very good question. As I mentioned, hypnosis has a variety of uses in clinical scenarios for pain management, management of stress and anxiety, and changing habits. These are the most common uses of hypnosis. But the first part of your question, how to find one, unfortunately, it's not easy to find a certified hypnotherapist. The main reason is all authorities on hypnosis try to limit public access to hypnosis, simply because, as I briefly mentioned, there is a potential for abuse with hypnosis. In wrong hands can be taken advantage of. But the best way is if you visit American Society of Clinical Hypnosis website, ASCH. They have a list of certified hypnotherapists all over the country. And based on your geographic location or zip code, they can assist you finding someone.
Mr. Hassan Nafi has a question. Mr. Nafi? You may be on mute. Okay. He chatted, according to his message.
There we go.
Oh, go ahead, Mr. Nafi.
You had just recently, Dr. Mortazavi, mentioned you had done a root canal under hypnosis. Was that something you would recommend for others?
Very good question, and thank you very much, Mr. Nafi, for remembering that. Yes, I had it. If you have multiple experiences with hypnosis and you are comfortable and confident that you can do that, yes, go for it. But of course, I don't recommend it as the first trial, because root canal, as you know, creates a very severe pain. So I'm not sure if it's a good idea for the first trial. But I can do it on myself. I can completely suppress the pain without feeling the pain. And since you mentioned that, it's not that you feel the pain, but try to tolerate it. Suffer, but try to tolerate. It suppresses the perception of pain, so you don't even feel the pain. Let me give you another very simple example. If normally you want to stick a needle into palm of my hand, as soon as you approach my palm, as a reaction, I will withdraw my hand and I won't let you do that. But if you give me a few minutes to use the self-hypnosis techniques and kill the pain, you can easily stick the needle. Of course, it has to be totally sanitary, but aside from that aspect of it, you can stick the needle and I don't even feel it. It completely suppresses the perception of pain. And talking about the subject, there was a recent and very interesting study done on pain.
Dr. Mortazavi, I think you hit mute by accident. There you go.
I was muted, but I don't know how this happened. Okay. I don't know until where you heard me. I was referring to a recent and very interesting study done on effect of hypnosis on pain management. It was done in Belgium, and study was done on 14 individuals who were experiencing severe, devastating pain, most of them end-stage cancer with bone metastasis that creates the worst possible pain. Of course, all of them were on high dose of narcotic for pain management. On the day of study, they stopped pain medications on all these individuals, on all 14 of them. And while they were in severe, excruciating pain, they obtained a brain PET scan. And you're a neurologist, you know it better than everybody else. So the PET scan showed in the area of the brain that's known for perception of pain, mostly the precingulate gyrus, that area was metabolically hyperactive, which was expected. They were feeling or perceiving severe pain. They had a hypnotherapist for this study, and the hypnotist hypnotized all 14 subjects and gave pain management suggestions under hypnosis. After the suggestion, they repeated the PET scan on all 14 of them. And amazingly, in 13 out of 14, the same area in the brain that was metabolically hyperactive was totally inactive, and in one person, it was minimally active. So it means that hypnosis can block perception of the pain. We don't know the exact mechanism of action, but we know it can block the brain.
Thank you. Thank you very much.
Okay, Dr. Adamnia, you had a question? Dr. Adamnia?
Hello. Hello. Thank you so much for an excellent presentation. My question, could this methodology help depression, especially for the young students?
Yes, very good question. Thank you. It can be very helpful, but unfortunately, the result does not last long enough unless the person becomes expert in self-hypnosis, and then they can get some help from self-hypnosis. It helps a lot more in stress and anxiety than pure depression.
Thank you.
I see some questions written in the chat box, so let me go over a couple of these questions quickly.
We have one from Lati Mordazi.
Okay, that's about self-hypnosis versus clinical, but I do not see the question. Extremely painful. It's extremely painful. Of course, it is extremely painful.
Yes, I'm sorry.
Effective hypnosis. Okay, interesting question. What percentage of people can be good subjects for hypnosis? If we exclude people with dementia and people who have mental retardation, almost 95% of general population, excluding these two groups, can be very good subjects for hypnosis. Interestingly, it does not matter if you believe in hypnosis or not. The only important factor is if you do not resist. If you don't want to be hypnotized, there is no hypnotist in the world that can hypnotize you. So unlike something that you might have seen in movies or stage magicians, it's not that the hypnotist stares into your eyes or moves some pendulum something and you fall back asleep. In real life, such thing will not happen. If you don't want to be hypnotized, and if you resist, you will not be hypnotized. If you are willing to give it a try, regardless if you believe it or not, you can be a very good subject. So to answer the question, about 95% can be a good subject as long as they do not resist. And as a dentist, I don't think it's possible, Dr. Modares. Actually, I know it's very hard to believe, but actually I have a witness, my dentist, who, Dr. Ozra Modares, you happen to know my dentist, who used to be in New Jersey and now in California. It was Dr. Shabnam Mosaddeq. And she's a witness that she did not use any local anesthesia or any painkiller or anything and did a root canal. Next question, how about dealing with phobia? Very good question. That's from Dr. Alilu. Hi, Dr. Alilu. Okay. Yes, that's another great area that hypnosis can be very, very helpful. I personally had a person, very, very smart and bright person who was one of the top administrative team of a hospital that I teach at. And she had a very severe cat phobia, who was very disturbing to her, disturbing her life. She couldn't even see a cat on the streets without screaming and running away. And fortunately, after, if I'm not mistaken, 3 sessions of hypnosis, or maybe 4, she was totally fine. And she, for the first time in her life, she could even touch a cat, something that she couldn't even dream of doing. So yes, hypnosis can be very, very helpful in resolving pathological phobias. That's a recommendation about the microphone. Has it been tried for TBN, which stands for trigeminal neuralgia? Well, any kind of pain, you can use hypnosis. But again, most important factor that I keep repeating is, first, we need to diagnose what causes the pain. If it's a constant pain, could be a tumor sitting there, could be an inflammation that needs another type of treatment. If you rule out organic causes, substance abuse and medication side effects, then yes, for any kind of pain, you can use hypnosis. Can hypnosis help forget a bad memory? Yes, it can help you suppress unwanted memories. Dr. Havakodi, I think you want to ask a question. Just 1 second, let me finalize this answer. Yes, if you have undesirable memories that you do not want to keep remembering, hypnosis can be very helpful in suppressing unwanted memories. The same way it works on changing unwanted habits. Effective for PTSD, post-traumatic stress disorder. Absolutely. Any kind of stress disorder and anxiety, hypnosis can be very, very helpful. That's from Dr. Gentili. I think I missed another one.
How to get licensed certified for hypnosis?
Yes, for hypnosis. Well, the highest society for hypnosis in the US is American Society of Clinical Hypnosis. You can approach them, and on occasions, which is not very often, but on occasion, they have courses to become certified. But you have to go through an extensive testing and evaluation first, and if you get the approval, then you can take the courses.
Ms. Modares, do you have your question? I think you didn't get a chance to ask your question.
Dr. Tavapodi, I saw raising hand. Do you want to ask a question?
Yes, I would love to ask a question. I'm sorry.
Please go ahead.
My name is Lati Modarisi. You talked about self-hypnosis, and I'd like to know what is the difference between self-hypnosis and meditation or mindfulness, because the way you were discussing it is through muscle relaxation and breathing. And to me, that's related to mindfulness or meditation. Could you tell me how you distinguish hypnosis from mindfulness or meditation?
Another very good question. Thank you very much for asking. Yes, in reality, meditation is kind of self-hypnosis. Basically, what do you do in meditation? First, you try to free and relax your mind. At the same time, you relax your entire body. The techniques could be slightly different, but the purpose is the same, and the outcome is the same. It results in a deep muscle relaxation as well as a mental relaxation. It can be done in different ways, and of course, it's named differently as well, but the outcome is pretty much the same. And the first part of your question, the difference between clinical versus self-hypnosis. Usually, if you want a deeper level of hypnosis, it needs to be done or guided by a hypnotist. For a simple or more superficial level of hypnosis, for a simple relaxation, self-hypnosis can work very well. But for something more serious, as an example, for relieving phobias that we just discussed, you will need a hypnotist.
Thank you.
You're welcome.
Dr. Mortazavi, can I ask a question?
Absolutely. Please go
Yes, my name is Tafel Gori, and I would like to ask you an unusual question through hypnosis. Well, in hypnosis, can you trick your mind, and would that trick be lasting, long-lasting, to rejuvenate and regenerate the energy through the endorphin of the brain?
Okay, the last part you got muted. I didn't hear the last words you said, but I think I got your question.
Let me just repeat my question. Is that through hypnosis, can you regenerate the energy through your mind, and that energy could be long lasting? So in other words, the endorphin would be releasing throughout your senior years.
Okay, another very good question. Thank you. Okay, so let me put it in a simple way. Under normal circumstances, all of us use up to 6% of our mental power. Under hypnosis, you can increase it up to or close to 100%. So it's not that infusing any power or any energy into your body or into your mind. It's just letting you get access to the most of your own mental power. In terms of rejuvenating, it cannot rejuvenate your body. However, it can make you feel more powerful. It can make you feel more energetic, and of course, more motivated to do and achieve whatever you want. So from that perspective, yes, it can be very, very helpful.
Thank you very much. That was a wonderful presentation that you brought for everybody. I appreciate that.
You're very welcome. Thank you for your kind comments. Okay, there's another question. It's a great lecture. Is there any limitation on how often we can do hypnosis? Another good question. No, if you're talking about self-hypnosis, you can do it as often as you need. If you feel the benefit, for example, to relieve stress or anxiety during a critical condition, you can use it several times a day if needed, and there is no adverse outcome with that.
I think one question,
how long is the pain relief with hypnosis if we want to use for cancer patients? Very good question. Okay, pain management is another very good use of hypnosis. That's the advantage of it, of course, without any side effect or adverse outcome. However, the disadvantage is it does not last for a long time. That's why whenever we use hypnosis for pain management, we do it for a few sessions. I usually do it for between 2 to 5 sessions. And after that, I ask the person to perform self-hypnosis. Usually after a few sessions of guided hypnosis, the person can do it efficiently on themselves. So whenever they need it, they can do it on themselves. Thank you for an interesting educational presentation. Oh, this is just a comment. Thank you very much, whoever put this comment. I appreciate that. These are comments. Okay, is there any relapse after treatment? That's from Dr. Hoseinpour. Thanks for the good question. It totally depends what you're using hypnosis for. And yes, there could be a relapse. For example, you have some unwanted memory that you want to kill. You use hypnosis, a couple sessions of hypnosis, and you get rid of that memory. So that memory does not rush into your mind. That unpleasant feeling or memory doesn't get to your mind without you asking for it. After a few weeks or a few months, the same thing may happen again. But again, when you know how to use self-hypnosis, you can do it again. And the good thing is, when you do it once for any purpose, the subsequent times, it's a lot more efficient. And you can do it in much shorter time. If the first time it took you 3 sessions to get rid of a bad memory, usually if you get a relapse after, let's say, a month or 2, with only 1 session of self-hypnosis, you can get rid of again. It may come back in another month, again, another session.
If you have too much energy, you cannot be hypnotized. Is that true? Positive energy.
Okay, chronic musculoskeletal pain. Yes, that's what we mentioned in general. Any kind of pain after you do a workup and you rule out organic causes, substance abuse, and medication side effects, any kind of pain, including chronic pain, can respond to hypnosis very well. Is there any medication by which you can induce hypnosis? Good question, thank you. There is absolutely no need to use any medications at all. Not only there is no need, we strongly discourage combining medication with hypnosis because you don't know where you got the result from. It was a medicine or the hypnosis. So there is no need to combine the 2 of them.
I think there is one question you may have skipped. Is there a link on the web to use to help practice it at home?
Very good question.
And the way to use a practice. Okay, yes, there are several websites. Unfortunately, not all of them are scientific or approved by authorities. There are many, many personal websites that somebody recommends different techniques to relax yourself. I have reviewed many of them, and quite frankly, most of them are okay. I didn't find any major problem with that, but some make recommendations that may not be very helpful. The best is use one of these authorized or well-known resources for hypnosis. The best of them, as I mentioned, the highest authority in the country, American Society of Clinical Hypnosis.
Last one we had, there's 2 other questions.
I have a question.
Can you do hypnosis as a telemedicine service? That's another very good question. Hypothetically speaking, yes. It's always more effective for the hypnotist to be present on site. Why? For unknown reasons. The person's mind is always more receptive when the hypnotist is on their side, as opposed to over the phone or any other telecommunication devices. To answer the question, yes, it can be done, but it's usually not as effective as doing it in person. Will be any personal secrets revealed during hypnosis? Yes, it can be, because during hypnosis, you can take the person back to their childhood, even retrieve memories that while you're awake, they cannot remember. Something that happened when they were a little kid, they were 4 or 5 years old. Something that caused a phobia at their current age, let's say in their 40s, 50s, and they don't know what caused that phobia during a session of hypnosis, and that actually requires a deeper level of hypnosis. You can retrieve those unwanted memories. And if any personal secret, as you phrased it, yes, it can be retrieved. And that's one reason that hypnotists should be a very legitimate person and respect personal space and personal confidential information. Does hypnosis improve functional capabilities in geriatric population? This is actually a very good question. Thank you. It says Mehdi, I don't have the last name, but a very smart question. Okay, yes. part of our function, regardless if it's geriatric population or younger, is our mental capability, how much we believe in ourselves. I'm sure everybody has experience. If you believe in your capability in something, you can do it much better, as opposed to if you think you cannot do that. Hypnosis can help you from that perspective. Hypnosis can give you the confidence and release your mental power. You will believe in yourself, and of course you will function and perform a lot better. Okay, there are some comments. Thank you very much, everybody, for your nice comments. I really appreciate that.
One more question.
Okay, I will get to you, Dr. Tafabodi. Just another interesting question. I have to answer this. Is it effective for patients with hallucinations? Dr. Hossainpour, very good question. Okay, hallucination indicates some major problem. Could be psychiatric or medical disorder, particularly if it's a visual hallucination. You know it very well, that you have to rule out all the organic disorders. If it's simply caused by mental disorder, as long as your patient is receptive, yes, it can help. But again, not if it's caused by any organic problem, like someone who has a brain tumor and causing visual hallucination. Hypnosis is usually not useful in that. And from your biography, it appears there's Shiver Medicals or sports. Oh, thank you. Okay. To contribute to success with self-hypnosis, can you elaborate on helping self-improvement? Thank you for a good question, and thank you for the kind comment. Well, I'm sure that self-hypnosis has helped me a lot, tremendously, in relieving stress and relaxing under stressful situations. I like to be very active. I like to try different fields in sports, in arts, and of course in my profession. If I can attribute everything to hypnosis, I don't know. But again, I'm sure it has helped me tremendously overcoming stressful situations. And another question by Dr. Modarisi: how can hypnosis help with weight loss? It can actually be very, very helpful. Okay. Weight is always a balance of, very simply put together, balance of how many calories you take in and how many calories you burn out. With hypnosis, you can help both ends of the spectrum. One, most people who suffer from being overweight, they feel hungry. They have a crave for food. And sometimes it's not just the required meals. There are other things they want to eat: chocolate, cookies, ice cream, cake. Well, I have to blame myself too. I eat chocolates a lot. Now, with hypnosis, you can suppress that unwanted desire. And it can motivate you to exercise more. So it can help reducing your calorie intake, while it can help you burn more calories by motivating you to exercise more. Most people, when they want to exercise, they feel tired. It's end of the day. They work hard that day. They try to postpone it to tomorrow. They need to rest more than they need to exercise. But with hypnosis, they can get that motivation. For other nice comments, thank you very much, everybody. I really appreciate your beautiful comments. Can I say, oh, what happened? Okay, there's a question by Dr. Voizi. Can we say hypnosis is more effective in mental disorder rather than organic diseases? Another very good question, thank you. Okay, in organic disorders, hypnosis can help you with the pain and some manifestation of the disease. It does not cure any disease at all. So please pay attention to this important fact. We cannot use hypnosis to treat diabetes. However, we can help the person to try to avoid eating sugar or taking lots of carbohydrates to help them manage their blood sugar. But in terms of treating organic disorders, of course not. Only suppressing manifestations of that. And that's why I repeatedly mentioned, before trying to manipulate everything, every symptom, every manifestation, you need to do a workup and make sure you know what causes that symptom, in particular pain. Thank you thank you very much, everybody, for your nice comments. I think the rest are only comments. Oh, there is one question, I think.
There's a question by Dr. Varzagan.
Yeah.
Yes, please go ahead.
And I think Jamie has a question too. There are three people who have raised their hand.
I think Dr. Papapodi had another question.
Miss Mimi Arjuman, Dr. Asghar Mirarifi, and myself. First of all, thank you very much, Dr. Mortazavi. It was a wonderful and informative lecture, since I'm very interested in that.
You're very welcome, my pleasure.
You know, point of really background. You know, Freud was using this hypnosis in his psychoanalysis with his patients, but he stopped using that. Although I think that with hypnosis, you can actually get into the unconscious mind of the patient, and the patient would actually release, you know, whatever information that he has about his past, you know, whereas if he's conscious, you know, there is a barrier there, you know, there is a filter there that this kind of unconscious mind doesn't come up. But however, he stopped doing that, although he was a psychoanalyst, you know. So what is your answer to that, please?
Great comments. Thank you very much. Let me just make a correction. We don't refer to it as unconscious mind. It's subconscious mind, because unconscious mind is not receptive. What we are talking about is subconscious mind, which means that the person's mind is receptive. However, they are not communicating with you in a normal, functional way. So that's called subconscious mind. And you're absolutely right. Freud was the first person to start psychoanalysis in a scientific form. Before that, many, many articles were written about psychoanalysis, but not in a scientific fashion. After several years of working on psychoanalysis, he decided to go ahead with his own theory of attributing everything and all human behaviors to their childhood experiences. So I don't think he ever stopped using psychoanalysis, but his focus was more deviated towards his theory and trying to prove his theory. He has been trying very, very hard to prove every intentional or unintentional behavior of human being has a background in their childhood. He would try to attribute everything to the childhood experience.
Yeah, that is why, you know, at first he was using hypnosis in order to draw information from the, you know, you call it subconscious, but, you know, he calls it sometimes unconscious, information to come up, because you actually avoid, you know, and childhood is part of it, you know, because Absolutely. He believes that everything stems from childhood, you know. Therefore, it was a very good idea to use hypnosis to get into the past of the person and go into his childhood and actually retrieve this information, although he stopped it, you know. I mean, what I have actually read is that Freud completely stopped that in his psychoanalysis of his patients.
Yes. Again, thanks for the great comment. Since you mentioned Freud, most of his work and his focus and his articles were on two areas, either anxiety or personality disorders. He had lots of work done on personality disorders, and again, attributed every personality disorder to the undesirable childhood experience. But thank you very much for the great comment. Any other questions?
Dr. Ajami also has a
question. Yes, I have one question. Do you hear me? I have a question.
Yes, please, go ahead.
Yes. This is not related to your hypothesis, but considering the current crisis of the corona, is there any scientific study on unexpected consequences of coronavirus in social relation, in individual behavior, in stress, and all the things? And if there is, what do you think of the future of humanity?
Absolutely. It's a very good question, but I wish I had the answer to that question. Future is unknown and nobody knows. However, very interesting subject. Let me take one step back. At least in New York State, where I work and practice, a few weeks ago, there was lots of talk and debate on process of reopening. I was approached and asked multiple times by different organizations and authorities, including New York State Department of Health and Office of the Governor, in terms of the timing for the reopening process and the phases. So my answer was very simple. If I answer the question from a pure medical standpoint, looking at number of cases, my answer would be very simple. It's way too early to start the opening process. However, if I look at it with a broader view and see all the consequences of this crisis, including, you're probably aware, since this crisis started, rate of substance abuse, drug intoxication, alcohol intoxication, and suicide has been significantly up. Why? Very clear. It's because of all the stress and tension this crisis has put on people. So when you put all these factors together and combine it with the financial consequences of a crisis, then the answer will not be as simple. It will be very complicated. From one end of the spectrum, if you look at it again from a pure medical standpoint, it's too early because we know that if we reopen everything now, we are going to have a surge in number of new cases, as we see it's happening. When we put all other factors together, again, gets to the more complex part of it. Because from one point, you want to help people with their financial situation, with depression and severe anxiety of being trapped at home, not being able to function, not to go to their gatherings, and therefore using more alcohol, using more drugs, and more intoxicated. So again, it's a very difficult question to answer, but there should be a fine balance in between, considering all the variables and factors.
Thank you.
Dr. Mirarefi has a question also. Dr. Mirarefi.
I really don't have a question. I just wanted to add my note of appreciation for the great presentation. We learned a lot from that. And it is such a nice opportunity to see you, Dr. Mortazavi.
Oh, thank you very much, Dr. Mirarefi.
Quite some time.
Thank you.
To see you and other friends all together. And I see it's a sign of recording is on. Is there any plan to have your presentation hosted somewhere? If it is recorded, I mean, build Kanoon or you yourself, host it somewhere so that we can always refer to it also in future.
Okay, that's a good suggestion. Thank you.
We'll post it on Puya's website.
With Dr. Mortazavi's permission, if he agrees, yeah, that's for sure.
Oh, absolutely. Of course, I don't have any problem with that. There's another question, another great question, actually. How can you measure patients' susceptibility to hypnosis? Any measure like EEG, etc. Of course, no organic measures like EEG. It's just a clinical experience. I briefly mentioned that, but let me repeat it and elaborate a little more on that. Many people approach me and they want to use hypnosis for any specific purpose. Some of them tell me, I don't believe in hypnosis, but since I have tried many other ways, many other modalities, but I could not get rid of this particular problem, I'm willing to give it a try. That's enough. As long as they tell me they are willing to give it a try, that's certainly enough. They can actually be a very, very good subject for hypnosis. But to answer your question, is there any particular way like EEG to do a pre-evaluation before performing hypnosis, just to evaluate and figure out that this person is a good subject for hypnosis and the other one is probably not? No, unfortunately, such thing does not exist yet. So it's just a clinical response to hypnosis.
I have a question, Dr. Mortazavi.
Yes, please.
Has there been a study where they do like a PET scan of the person under hypnosis and see which part, what are the functional parts of the brain that are, getting involved here?
Yes, as I mentioned in the study done in Belgium, The subjects were in severe pain, mostly because of end-stage cancer with bone metastasis. And the PET scan before and after hypnosis showed that that area of pain perception in the brain, which was metabolically hyperactive prior to hypnosis, became, in most of those subjects, completely inactive, and in 1 out of 14, minimally active after hypnosis. So it has something to do with central nervous system, but we don't know the exact mechanism of action.
Thank you.
There's one more question. I think there's a hand up from this Arjuman. This Arjuman?
I have a question too. I've been ignored all day.
I have a question.
Sorry, to ignore anyone at all.
I don't see the hands up in the...
Somebody's trying to talk, but the microphone is muted. So please make sure if you want to start talking first, unmute your microphone. Yes, please, Dr. Arjuman, I'm listening. Mr. Yavari.
Yes, doctor. Thank you very much for your nice presentation.
You're very welcome.
I would like to know if there are some misconceptions about this.
About hypnosis?
Yes, sir.
Yes, as I opened my lecture by mentioning that there is lots of misconception. Why? Because most people have gained some idea about hypnosis from movies, shows, or stage magicians, not from a real certified hypnotherapist. What they see on the stage, that the hypnotist tries to control somebody else's mind, is not a real hypnosis. It's not the purpose of hypnosis. We're not trying to hypnotize someone to gain control over their mind or to demonstrate power. But in reality, yes, there is lots of misconception about hypnosis. A good example is people think if they encounter a hypnotist, the hypnotist may be able to put them artificially to sleep without their consent. And I can assure you, this will not happen in real life.
You mean they lose their will, right?
Yes, yes, this will not happen.
Yes, sir.
But thank you for the great question. Thank you.
Thank you.
Dr. Fatemi.
Fatemi, you wanted to ask a question?
Yeah, I want to ask a question. If anybody were to do hypnosis on patients, I'm sure you have tried it on your own patients, does the insurance company pay for that? Medicare, Medicaid, do they pay for it?
Medicare and Medicaid, unfortunately, no, CMS doesn't pay for hypnotic session. However, some HMOs started paying for hypnotic sessions, yes.
So I assume PPOs pay too.
I'm sorry?
PPOs, I assume, pay too.
Yes, for specific purposes, not in general. For weight management and smoking cessation, they pay. As far as I know, for phobia, no, there is no payment. But for weight and smoking, yes. And you can guess why HMOs or PPOs started paying. Because they pay a little bit of money, but then they prevent future problem with that person, with weight management problem and smoking and all the consequences of that.
Right.
And thank you.
I just wanted to say thank you for the great talk.
Oh, you're very welcome. My pleasure.
It was wonderful, like always.
Oh, thank you. Thanks.
Thank you.
There is another question. Could we use virtual reality? This is Dr. Arabi. It's from Iran. Hi, Dr. Arabi. We use virtual reality and augmented reality to teach hypnosis to MDs and patients. Well, and actually the question continues, extended reality, including virtual and augmented reality techniques, could be helpful. Okay, virtual reality and augmented reality technique, they are both useful modalities for stress management. Using it to teach hypnosis, like any other educational program, probably yes. But if you take sessions for hypnosis, a very good portion of that is practical work. So not all of that can be done virtually. Only the initial introduction and the theory part of that, certainly yes. But when you get to the practical part, it has to be on site. But thanks for the good question. Any other questions?
Dr. Shahli?
I have one more question, Dr. Mortazavi.
Please go ahead.
Yes, another unusual question from my side is that I've heard people under hypnosis they've been going through their past life and many generations of the past lives, and even they spoke different languages. Have you heard about that, and do you verify that?
Okay, this is another area of misconception with hypnosis. This is something that a stage magician will do just for purpose of entertainment. There is a regression therapy in hypnosis that we can take the person back to early childhood. But the previous life, no, such thing does not exist. No hypnosis can ever get access to previous life if such thing exists. So to answer your question, no. If somebody is claiming that, is again for the purpose of entertainment.
Thank you for the clarification. Thank you.
You're very welcome.
I think if you don't have any questions,
I think Ms. Arjumand had a question. I don't know.
There's one, the last question, what is the longest duration under hypnosis?
Oh, what's the longest duration under hypnosis? Okay, another very good question from Sam. Okay, we don't know the longest duration. However, there are cases reported that a hypnotist hypnotized someone to a deep level of hypnosis, but for some reason, they did not bring the person back to full level of consciousness. They left the person. And there are reports that the person was sleeping for more than 48 hours. I'm not sure if it was the longest ever or not, I don't know, but up to 48 hours, it has been reported. Normally what happens is if you put someone to a deep level of hypnosis and then you leave them alone, after a few hours, which is usually around the same time the person gets sleep in 24 hours. The person gradually changes from a hypnotic sleep to a regular sleep, and then they wake up. But again, there have been reported of cases that the person did not wake up for much, much longer period of time. And the longest one that I'm aware of is 48 hours.
Is there any medication contraindicated for someone doing hypnosis?
Any medication contraindicated? That was the question?
The last
good question, thank you. But as I mentioned, we prefer not to combine medications, in particular analgesic or hypnotics, with hypnosis. If someone wants to use medication, they can use it another time, not in conjunction with hypnosis. Yes, Dr. Potter. But
when they put you to sleep, when they put you to sleep with hypnosis, does it take you to the REM phase of sleep?
Very good question, very smart. There have been studies on that. Most of the time, no, you don't get to REM phase of natural sleep unless you leave the person alone after putting to artificial sleep. After a few hours, the person, that was what I was explaining, that it may convert to a regular sleep. That will be the REM phase of sleep. But if you hypnotize someone for a particular purpose, you want to give positive suggestions, let's say on weight management or smoking, and then you wake the person up. The whole session could be half an hour or so. Under these circumstances, no, the person will not get to the REM phase of the sleep. But that was a very smart question. Thank you. Yes, please.
Ms. Arjumand, just
Mr. Nasrullah, you have a question, but you are muted. Please unmute your mic first. Yes, you're unmuted. Yes, please.
Thank you for scholarly presentation. I really appreciate it.
Oh, thank you for your kind words.
It was purely scholarly. My question is right now, at this period of time with the sickness involved, how do you manage political stress? How do you manage political stress this period right now we are in?
Yeah.
People are inside, outside. There's a political pressure from news media, from how to control that stress.
Okay, are you talking about the political pressure?
Yes.
Political, not pressure, political stress.
Political stress and political oppression.
What I'm saying is,
pressure and stress,
at this time, you're isolated at home, all of the political stress, watching news, outside, inside, how do you stress that? And it's always go back to gentlemen asking the divorce and the alcohol and this and that. That's not the solution. What's the solution to control political stress
You're absolutely right. And as I mentioned, when we were talking about reopening process, we have to consider all these factors, including all the mental pressure, stress, and tension this crisis is putting on people. Simply being isolated at home and not getting involved in gatherings is a big stress by itself. Add to that the financial consequences of that. Many people lost their job. And of course, it's a big emotional trauma when somebody loses a job, and loss of income, of course, adds to the problem. Different people have different ways to deal with stress. Usual ways, some people take medications. Use of medication during this period has been significantly up. Some people try to go to alcohol. Use of alcohol has been significantly up too. I mentioned drug abuse and drug intoxication has been significantly up, and unfortunately even. So
my question is, how you control that?
I'm sorry?
My question is, how you control that because of no alcohol, you know, if you want to go through that process, you can, you know, negative. Positively, how you can control that stress.
With self-hypnosis and self-relaxation. Whenever you feel the stress is overcoming you, instead of using anything else, medications, alcohol, or anything else, you can try a session of self-hypnosis. And I can assure you, you will find it very, very helpful, a lot more helpful than other ways to deal with stress.
Thank you very much.
You're very welcome. The first experience may not be very helpful, but do not get disappointed. Do it the second time. I can assure you the second, and in particular the third time, will be a lot more effective than the first one. So if the first one, you see even 10 to 20% improvement in your symptoms, that's great. So don't think it will stop there. Do it again another day, and you will see much better response.
Thank you.
You're very welcome. Any other questions?
Is it helpful for court investigation? Asked by Adam Hosinpur.
Okay, I mentioned this part. If hypnosis can be used in criminal investigation or not. So let me just briefly mention that part again. Well, the question is, if we hypnotize a criminal suspect and have them confess under hypnosis, and if we get this confession, is it valid in the court? Is it considered a solid document? Not in the US, but in Russia, yes. Russia is the first country in the world that officially and routinely uses hypnosis in criminal investigation. In the US, Nevada is the only state that accepts hypnotically obtained statement as an evidence only. It's not a document, meaning that if someone, while they are fully conscious and cooperative, not under any medications or under influence, they write and sign a confession, it's a solid document in the court. They cannot even take it back. However, if the confession is obtained under hypnosis, it serves only as an evidence, just like a witness. So the witness, of course, from a court's point of view, witness is important, but witness can lie too. So it's not a document. Just because someone has a witness doesn't mean that they did not commit any crime or any wrongdoings, but it can serve as an evidence. A statement under hypnosis is the same in state of Nevada. And in other states, in New York, New Jersey, Connecticut, in your state, Georgia, no, it cannot be used at all.
Yeah.
Well, thank you very much, Dr. Mortazavi. We really appreciate your time and the wonderful information that you presented to us. We appreciate everyone who's joined us on this lecture. Hopefully next time we'll be able to be live. And we would, with your permission, we would love to have the link on our website, if that's okay with you. And that would be found on www.puya.net. Please, support us. Look on the website for future events and lectures, as hopefully we'll have more lectures despite the COVID situation. And thank you very much for everyone's support and participation.
Thank you very much to you and all other people involved in organizing these great lectures. And as you mentioned, I hope next time it's in person and I get a chance and the privilege to meet everybody in person.
Thank you very much.
Thank you so much.
Thank you, Shervin.
Have a great night.
Very good.
It's very nice.
Thank you so much.
Merci.
Thank you, Dr. Hidari.
Yeah, thank you, Dr. Hidari. Thank you, Dr. Garmiston. Yeah, thank you, Dr.
Thank you, Dr. Vataga.
Yeah, Dr. Mortazavi, we
Thank
had
you, everybody.
plans for you.
Thank you to all of you.
Yeah, thank you. Thank you so much. Thank
you, Alay Doctor. We enjoyed it.
Thank you.
It's a great night.
مرسی.
Thank
دور
you.
خانم سلام.
واقعا خسته نباشین، دست در نکنه.
مرسی همه. بای بای.